Number 2 of 10, federal government spending. First, why is this important? Many of you write in your supplemental answers an answer saying the government should be spending more to cover all US lives and insure them. This video could probably prove to you that that's not possible and that they're doing their best already. Number 2, if you were a dentist who wants to have a private practice and not cover Medicare patients because Medicare reimburses far lower than a private insurance does, you probably want to know how much of a patient population you are missing out on. Or, alternatively, for those who want to do philanthropic activities, you can very much do philanthropy by catering to Medicare patients who would pay you far lesser but are so much more in number. Let's get into all of that in this video. There are 330 million Americans on average. And for them, the healthcare spending is 3.3 trillion. Now, out of these 330 million Americans, 40 million Americans are not insured. The remaining 292 million Americans are insured either by the government or by a private company. So we saw $3.3 trillion being spent on 292 million Americans by majorly two groups. Among these two groups, the federal government, which is like your central government, spends almost 28.1%. That's 1/3 of all the money that could be spent. That means the federal government spends close to $1.1 trillion on 100 million Americans each year. Can you imagine? That's the highest percentage within a country's GDP that any country would spend globally. That means the threshold for spending cannot increase further. The government is not going to put more cash into the hands of physicians and health systems to treat Americans. They're going to constrict it and make it a lot more efficient rather than increasing the reserves. Out of the 28% that we spoke about, 20% is covered just by Medicare and Medicaid. Medicare is largely owned by the central government and Medicaid is largely owned by the state government. However, there is a portion of Medicaid that is also funded by your central government or your federal government. So what is the difference between Medicare and Medicaid? Medicare is only for adults who are 65 and older. It's for the elderly population that the government spends most of its cash, 10% of $3.3 trillion. Do they have that many needs in healthcare needs? Yes. America's geriatric population are growing older and older, living longer and longer, and needing more healthcare services because they have several underlying health conditions that they have developed in their youth. So the government naturally has to spend the most amount of money for them. That's almost 10.7% of total spending. After Medicare, we have Medicaid. Medicaid doesn't have any age restriction for the patients who want to access it. Medicaid is primarily for patients who do not have access or do not have the socioeconomic background to afford healthcare. So on a charity basis, the government does spend money on special cases to help them get secure access to healthcare. Now you might wonder, if Medicaid does exist and 8.7% of all spending goes through Medicaid, then what about these 40 million Americans who are uninsured? Are they the ones who are covered through Medicaid? Yes. It could be either of two cases. Either these 40 million Americans who are uninsured in special cases can access Medicaid if they fill up a certain criteria based on how poor they are, which city they are from, which hospital they want to go to, what treatment they want to get, and so on. And also sometimes people who are already insured by either Medicare or private insurance and still cannot afford the huge excess bills that they might get from a hospital. Medicare does help subsidize some of that cost as well. A very important takeaway. If you are going to an interview and we're going to speak about Medicare and Medicaid, you need to know how many Americans are currently accessing these two healthcare schemes. You need to know that Medicare and Medicaid are sponsored by the federal government, and that comprises $1 trillion of all healthcare spending. That covers 100 million Americans, almost 1/3 of all Americans. So by neglecting that population, even though Medicare pays lower than private insurance, you would be neglecting a huge patient population that needs healthcare in the US. Another fact is we cannot push Medicare or Medicaid further to spend more because US is already one of the highest, US is already one of the countries that is spending the highest percentage of their GDP on healthcare. So the threshold is already crossed, we can't push further.
If you want to make your CAAPID application process easier, hit subscribe now, show your support and love, and we will keep helping.